Thank you for joining us at the CTSNet Roundtable, where today we'll be discussing tips for building a practice early in one's career. My name is Mara Antonoff, and I'm a thoracic surgeon at MD Anderson Cancer Center in Houston, and I'm joined today by some cardiothoracic surgeons with a variety of different experiences. Let's start by meeting our panel. Can you please both introduce yourselves?
Sure. My name is Damien Lepar. I'm currently in my second year. I'm a pediatric congenital heart surgeon at Columbia University in New York.
My name is David Odell. I've been in practice for 6 years. I'm a general thoracic surgeon at Northwestern University Medical Center in Chicago.
Terrific. For surgeons in their first few years of practice, there can be a lot of competing needs: growing a practice, establishing a team, developing referral basins, and even finding one's research niche. It can be a particularly stressful time, and today we're going to address some of those issues. Let's start with a question about mentorship. Dr. Odell, what role does mentorship play in helping newly practicing surgeons continue to grow upon completion of training?
I think that's a really important question, Mara. The role of mentorship is really critical, not only early in one's career, but as we continue to grow and develop our practices as we move forward. Surgeons that have good mentors are far more likely to seek leadership positions, both within their institutions and extramurally. They're more likely to advocate effectively for themselves when it comes to things like program development, engaging in research, as well as just things like their own compensation. So mentors are really a crucial part of our continuing professional development.
Would you agree, Dr. Lepar?
Yeah, I think, as Dave mentioned, mentorship is the key, I think, to everyone's success. And I think everybody that I've talked to over the years, and all of my mentors, have constantly talked about the role that their mentors have played in their lives. And I think that one of the things that becomes apparent, or especially early in your career, is developing a relationship with somebody where you think that you can completely rely on them when you need them, and then also have them understand where you are in the process so that they can help facilitate you in whatever it is that you're needing, whether it's research, whether it's clinically in the operating room, or whether it's just having a life mentor to help you figure out how to balance everything. I think we probably all have various mentors for all different areas and different stages in our lives, and I couldn't emphasize enough how important that's been for me, especially in my first year out.
So speaking of this early period, since you've come out of your training and have developed a practice, let's change gears a little bit. As you're building a clinical practice, can you tell us what are some of the key considerations that you need to think about when it comes to communicating not only with referring providers, but also with patients and their families?
Yeah, I think this is something that I think is critical to your success, especially for your whole career, but especially early on, because often when you come out, you really have nothing to offer except for everything you've done in your past and what everybody's talked and told people about you. And so I think establishing early lines of communication with referring physicians and families is critical. I think the first thing that I've learned, often a lot of times from my mentors, is how important being honest, truthful, and upfront is, and how far that goes with your referring providers as well as the families. Unfortunately, sometimes things aren't always going to go the way that you expect them, or the way that your referring cardiologist or referring oncologist expects them to go. And it's often those times when it's very difficult to want to make that call, to talk to the family, to call the referring cardiologist or whomever. And those are the times when I think you have to do that the most. And I think what I've learned is that by being truthful and honest, it makes all of those, all the different people involved feel comfortable with you. And I feel like when they feel they have access to you and that you're going to be open with them, I think that helps build momentum. And then I think the momentum begets more momentum and all of that. So I think I couldn't emphasize enough how I think important it is to openly communicate with folks, even when the time seems like a tough situation.
Sure. Do you have any thoughts?
I couldn't agree more. I think those, particularly the concept that those periods where things don't go well, where it's difficult, I think for many of us that's a period where we're almost going through some grieving ourselves about how the situation has evolved, and you don't want to be isolated in those settings. You want to really engage with the folks who have been part of that patient's care team, including their family, the physicians that have referred them to you, and the other folks that are around and helping you care for them in those difficult situations. And you want to be seen as someone who's bringing the team together, not trying to fracture or splinter people apart or keep information away. And I found that both families and referring physicians really respect you more when you communicate in those situations. I think everyone understands that what we do is very difficult, and as you said, things don't always go the way that we hope that they will, but it's how we manage those situations of stress and difficulty that reflects on who you are as a physician, and that's ultimately what those referring physicians, what the family members will remember, and they'll respect you more for it.
I would also add, I think one of the things I've learned, especially in my field in pediatrics, is it's very important to understand the relationship that exists between that referring provider and that patient.
Yeah,
Oftentimes, that relationship has been fortified and built over many, many, many years, and we step in a very discrete, isolated period of time in that patient's life and care, whereas the relationship that they built with that referring provider is something totally different. And respecting that and understanding that, and taking stock of that when you're having these conversations, I think really, really helps to build that relationship.
Right.
Because they want you to understand that. And sometimes it's not apparent when you're just focused solely on what it is that you're going to do in the operating room.
You made a point that especially early in our career, communication is particularly important. Of course, it's important throughout our career as we take care of patients, but particularly in the beginning. And I could really emphasize that quite a bit. I feel like even in the times when we're not dealing with a complication or a difficult situation, just in establishing that rapport and that trust with a patient. For me, I walk into a room and I may not be what that patient and their family member imagined when they heard cardiothoracic surgeon. Now granted, in this day and age, they've probably already looked me up online and they know what they're getting, but in general, I might not be exactly what someone expects when they make an appointment with a cardiothoracic surgeon. And by walking into that room and being very thorough, taking the time to educate my patients and their families, thinking about what their perspective might be, where they're coming from, really learning what their day-to-day life is like, it does make the visit a little bit longer. That's certainly the case. But I feel like the extra moments that I spend communicating with them at the beginning really instill that trust in me and make them feel comfortable with me taking them to the operating room. If things go well, then you've established a wonderful relationship, but then if things don't go ideally, you're not only trying to make up for that communication on the back end, but you've already established a little bit of a better relationship and that trust up front with the communication at the beginning.
If you think about it, it's a pretty unique situation that we find ourselves in, where you encounter patients, you encounter their families at really what's often the most vulnerable point in their life. And you're talking about doing probably the most dramatic thing physically that's ever happened to them in their life. And oftentimes these are very short conversations. And it's amazing what the little things like taking the time to sit down while you have that conversation in the clinic room as opposed to standing up, the messages that we send, and giving the patients the idea that we are part of your team, just as the physicians that have been longitudinally part of their care are an important part of their team, making sure that they feel valued and making sure that the patients feel as though you've really listened to what's important to them.
Yeah, I'd say probably one of the best piece of advice that I got from my early career related to relationships and referring physicians. One of my mentors told me that you have to understand when you start, especially if you're starting at a new institution and they have no background history, you didn't train there, these cardiologists or whoever the referring physician is, they know nothing about you. But if you establish a great relationship with the patients, the feedback that they're going to get is going to come back through the patients to them. They're not going to hear much about what you did in the OR or how this is going to play out, but they will hear about the amazing relationship that you developed with the patient, and that matters a lot.
Absolutely, that's terrific advice. I know that as academic surgeons, you both not only take great care of patients and communicate with families, but you're also pulled in a lot of other directions to be engaged in research, scholarly activity, and administrative functions. I'm wondering, Dr. Odell, if you could touch on how one goes about establishing a niche, and particularly from a research perspective, and whether that's something you need to do early in your career, or if you should take some time and develop a clinical niche and then follow in suit with your research niche. What advice do you have?
I don't think there's one right pathway. I think that this is really something where you have to turn the lens internally and really kind of think about what it is that's important to you, what you find value in, what you find to be fun. The people who I think have been most successful doing this, and some of the best advice that I got simultaneously from one of my clinical mentors and one of my mentors in the research world, is to try to find opportunities to create synergy. If your research topic is completely disparate from what you do in the clinic every day, your mind is kind of living in two different places, and it's very difficult to kind of keep making that switch from one place to the other. If you can get your research interests and your clinical interests to align, they tend to feed one another. In the research world, you're reading more about the things that you can then employ in the clinical world. The clinical components of your practice will inform what are really the most valuable and rich research questions. And if you can find that synergy, a lot of the controversy and the conflict that we run into in terms of time and how we're attributing our efforts, those things go away because they're really being done in concert with one another.
One of the issues with which I think we may struggle is that sometimes our clinical niche may be determined by the needs of the population whom we serve or the gaps in our practice group with which we're already working, and that may not always match with what our intellectual interests might have been. So I think it's a difficult balance. Sometimes it's a little give and take, and you may be able to eventually develop a clinical niche in the area that's your research interest, but if there isn't a need in a specific time or location, that could be a challenge. What are your thoughts?
Yeah, I mean, I would agree with both of you, and ideally in the perfect scenario, then you're able to synergize both your clinical and basic interests or academic interests. I think probably more importantly, though, is we've all had experiences in our lives in doing things that we're not entirely passionate about doing, whether that's in academics or not. And I think finding a passion about both your clinical and academic pursuits is probably the key. And that's the cornerstone to success, because if you're not interested in it, it doesn't really matter even what infrastructure may or may not exist at your institution for that. But usually, if you're very excited, very passionate, and you care deeply about pursuing something, even if the infrastructure doesn't exist, you figure out a way to knock that wall down and build that and do that. So finding that, I think, is the key. And then in terms of the balance, I mean, that's just something that comes with practice and time management. I mean, at this point in our lives, and usually by the time most people are in early careers and starting out, they've somehow been able to balance multiple things. It's just an extension of all the skills and using the techniques that they've done so far to adapt those to now their new roles. And one thing that I've found that's been very successful and helpful for me is to constantly, literally every 3 months sit back, look at everything and figure out where the imbalance may be in my academic or my professional or my clinical or even personal life is, and try and rebalance that. And I kind of look at it as kind of like a portfolio, so to speak. And you try and have a balanced portfolio, and you try and meet with your financial advisors. Well, I have advisors that I sit and rebalance my professional and personal portfolio with. I think finding those people, again, it all comes back to mentorship. Finding those people that can help you do that is key. But having an approach to where you do it consistently and regularly, I've found for me has been very helpful.
You have to plan to succeed. And I think a lot of this, to your point, Damien, comes down to the mindset with which you approach those challenges that are put before you. If your hospital needs you to run, a program in esophageal surgery, and your interests are all in lung cancer, don't view this as a task that you have to take on that's going to detract from other things. View this as an opportunity for you to, explore and ask new questions. And even if this isn't kind of what you would have a priori defined as what your pathway was going to be, I think we've all had experience being opportunistic and kind of taking advantage of the low-hanging fruit, whether it be in research or in clinical opportunities. Hey, this is the case you can scrub today. Take the most advantage of the opportunities that you have before you. And I think at sort of a peer level, people will understand the benefit that you're bringing in that setting, and that's going to open the door for more and more opportunities for you to succeed.
At this early stage of our careers, I think we often get offered a lot of opportunities to get involved in a variety of activities, whether they be research collaborations or taking on new patients, administrative roles. And some advice that's been offered to me that I think is terrific is, as Dr. Lepar mentioned, thinking about your goals and having an idea of what your goals are in every area. What are my administrative goals? What are my academic goals in terms of research that I want to accomplish? What are my goals clinically? And what are my goals personally in terms of wellness and family and self-care and all of those other issues that you may want to consider? And while it is very helpful when you're offered a new opportunity to think, does this fit with one of my goals? Does it align? That is generally a fairly good way of deciding if you want to do something. But as you mentioned, sometimes it might not seem outwardly to be directly related with one of your goals, but actually, ultimately, it does, because you're showing a potential referring physician that even though this might not be the best patient that aligns with your interests, you're developing a relationship with that referring physician to build a pathway for future referrals, or helping out a collaborator with a research protocol that might not be your exact niche of interest. If this is someone who also shares other interests that are of relevance to you and you help this individual out on this project, they're going to be a collaborator for future projects. So it's a delicate balance of trying to only say yes to things that do align with your goals, but recognizing there may be hidden benefits that may align with a different goal that you might not have noticed if you don't take the time to think about it.
I think it comes down to citizenship, right? You know, if you're part of a community as a physician, whether that's the community of, you know, of the hospital setting with the referring physicians with whom you work and the other surgeons with whom you work, or a community in the research world, or a community in, you know, in your home life. I think some of it is understanding that there are things that we do because they're really self-motivated. They're things that are important to us and we're the drive behind them. And there are things that we do because that's part of what's being a good citizen. It's part of being a member of that community and helping out. And you know, I think you have to have a balance between those things. But I think you have to understand that it's not, the pendulum is not always going to be in one direction or the other.
Sure, that makes plenty of sense. Another question for you guys. Do you have any tips for how to continue to learn new skills after your formal training has ended?
Yeah, I mean, I think that's incredibly important in any area of cardiothoracic surgery, because we live in a time of evolving technology, evolving techniques, challenging, you know, even less invasive approaches to things. And so I think that early on in your career, if you develop a mindset that your career is going to be one of continued education and you know, self-development, I think that's important. In terms of you know, opportunities and finding those, I think the easiest thing is to look within the organizations. You know, organizations like the STS, the ATS, the regional societies, they all have tremendous opportunities at their meetings to gain extra experience. And then also within industry too, a lot of the, you know, relationships you're going to have with various industry sponsors for events are going to be key. I attended a surgical course for a Ross procedure this past year, and it was a fantastic opportunity to have. And I think you have to look for those opportunities out there, and you have to be willing to take those. And on top of that, you have to rely on the surgical community itself. You know, if I know that a surgeon at another institution has really gotten good at doing something and I want to learn how to do that, I should probably just go and spend time with that. And you have to find institutional support, and you have to build that relationship with your partners and your institution that they want to support you in those endeavors, and then you got to go find those times.
I think in addition to that, you also can leverage the community at your own institution. You know, it's very likely that your partners are doing things slightly differently than you are. Even if it's not a wholly new procedure to the institution, it may be a slightly different way of doing a procedure that you already do. And you know, taking the opportunity to scrub with your partners, or even just to go into the operating room, you know, during turnover time for your own cases and see what your partners are doing, can be very informative. I've personally learned a lot, and I've modified a lot the way that I do common things, lobectomies, based on the way, you know, my partners place their ports, and you know, how they use their retraction slightly differently than how I was trained. Mm-hmm. And I think being just open to the idea that even the folks that you're around every day can potentially teach you something new can be really incredibly valuable.
Well, this has been a really productive conversation. I hope that it's instrumental to people in the early stages of their career. I know that there are a lot of other roundtables and other informative videos on CTSNet that can be helpful to people early in their career, not only in developing new techniques for surgical procedures, but some of the discussions that are held to help really guide some of these critical issues early in one's career. Aside from all of the wonderful information available on CTSNet, are either of you aware of any information provided through any other societies or organizations that can be instrumental to people in this early stage of their career?
So I think one of the great resources that's available to us is actually the Early Career Development website hosted by the STS. There are a number of resources, from frequently asked questions to blog posts that are written about many of these topics that kind of go into a little bit greater detail. We're also working on the development of a mentorship portal that will more formally connect surgeons, you know, with folks who can serve as mentors for them in any of these aspects, from building an academic career to kind of technical questions to questions that evolve around the balance between your work life and your life outside the hospital. Recognizing that not everyone may have access to all of these resources within their local institution. So I think that understanding that there is a network and a community out there that is very willing to be helpful is something that's a really important message for all of us as CT surgeons.
Absolutely. I'm very excited about all of these efforts coming out of the career development workforce from the STS. And likewise, I think for others to be aware, there are opportunities through all of the other organizations through which we participate. The Women in Thoracic Surgery also has mentorship opportunities to connect individuals with others. And it's been emphasized over and over during this discussion how important mentorship can be really in guiding early career surgeons. Do you have any closing thoughts, Dr. Lepar?
No, I mean, I think that this is, I guess, yes, I do have some closing thoughts. I think that this is, it's an exciting time period. It's also a challenging time when you come out. And it's a unique period in your life where you're trying to find and get comfortable in your skin in a variety of new roles. And I think that, as we've talked about, reaching out to not only the various organizations that are putting into place networks for you to do that, but then really developing tight and close relationship with your partners is critical. If you don't have a good relationship with your partners, then it makes life that much more challenging. So really invest in that, because I think that is critical to your early success and helping you to become comfortable as you're starting it out.
Terrific. Well, thank you very much. We appreciate you joining us for this roundtable today.